As we begin, we want to welcome you and take a moment to share the mission of the Parkinsons Foundation. Every day and in everything we do, we are working to make life better for people with Parkinson's. One example of our mission in action is PD generation. This research offers genetic testing for PD-related genes and genetic counseling to people with Parkinson's at no cost. Commit to helping us advance Parkinson's research today. Check your eligibility and enroll now to be part of PD Generation at parkinson.org/PD Generation. Today, we return to our mental wellness series and will address Parkinson's-related thinking changes. Thinking changes are common in Parkinson's disease and can start developing even before diagnosis. Though these changes can be mild, especially early in PD, they can significantly impact the well-being of a person with Parkinson's, as well as the people closest to them. Today, we will hear from experts, people with Parkinson's, and a movement disorder specialist about treatment and coping strategies for people with cognitive changes or challenges. Following the conversation, we will have a live Q&A session. And now we will share the conversation between two people with Parkinson's and our specialist. Thank you for joining us today.
Welcome. We're happy to have you join us here today. We're going to be having a conversation about thinking changes in Parkinson's. My name is Lisa Cohn. I am a person who lives with Parkinson's. I was diagnosed in 2008 when I was 45, and I now live in Denver, Colorado with my husband. I'm going to serve as a quasi-moderator and participant in this discussion. Johnny, would you introduce yourself?
My name is Johnny Miller, and I have had Parkinson's disease for at least 22 years. Let me be the first to congratulate me. I'm blank. Go ahead.
Something about your profession? Okay. And Joe, you want to introduce yourself to us, please?
Yeah, I'm Joe Quinn. I'm a neurologist, and I am at the Parkinson's Foundation Center of Excellence in Portland, Oregon. I've been a neurologist for 30 years now and have spent the last 15 or so focused on Parkinson's disease and thinking changes.
Great. So Johnny and I both are participating because we have experienced thinking changes. And we want to talk about our experiences and get some expertise from Joe. And I'd like to start off by having Johnny tell us when and what did you notice? Like, how was it that you first began to wrestle with thinking changes?
Well, I didn't know at the time that I had Parkinson's disease, but I did know that things were changing around me. And the climax of it, at least that first stage, was one day when I was interviewing one of the staff members, and as he talked, all of a sudden his words all blended together, and I couldn't make sense out of them. And I told him, I can't process what you're saying. Can you be quiet just a minute and let me think about this? And I put my head down on my desk, and he couldn't be quiet, but as he talked on, I recognized I'm just not understanding what's going on. And that was the very first big recognition that things were changing for me.
This wasn't the first thing that changed for me, but Johnny, have you ever done the don't talk to me, I can't do two things at once?
Oh, yes.
Like my family is but like Johnny, my first recognition was also work related. And so at that time I was expected to have executive functions. And there were two things. One was it's sort of the flip of Johnny's, I used to give presentations and they'd be on subjects I knew very well, but I could no longer explain them in a way that others understood. And I wasn't aware of that until I got the feedback that people didn't think I knew what I was talking about. And I thought, what is happening? And then another example is I would do scenario spreadsheets, where I'd change a variable, and I couldn't keep up with my changes, my edits. So I had shared something with, fortunately, 2 colleagues who were like friends of mine, and it didn't make any sense. But I couldn't see that it didn't make any sense. I could no longer edit myself. Joe, what are the most common experiences that you've seen?
The experience of when you were describing, don't talk to me, I can't think about 2 things at the same time. I think that kind of captures what I hear most frequently, is that multitasking is in the early stages is the area that people have the most trouble with. And people who study cognitive function for a living refer to the ability to tune things out and focus on different things and to sequence and plan and everything. They refer to that as you described as executive functions, and that's often an area where I hear people even in the earliest stages of disease tell me about.
Yeah,
So could you explain the executive function a little bit more, because it was so important when I realized that it was my brain that was off cue, and I had to somehow find out how to use my brain again.
Yeah. Well, executive function is a tricky term, and because a lot of different things are under the umbrella of executive function, but it's thought to represent things that occur in the frontal lobes of the brain, and it can involve focusing of attention and multitasking, being able to move back and forth that way. It can involve sequencing, planning out and doing things in a sequential order, and other kind of higher level attention functions. So it's a collection of functions that are all put under the umbrella of executive function, but people in the early stages of Parkinson's disease will not infrequently complain of problems. And what they usually tell me when they're able to articulate it well is the multitasking issue.
Right.
That it's people have trouble doing more than one thing at the same time and shifting their attention back and forth.
I would guess that I wouldn't have used the term executive function at that time. I would have said my experience was.
Yeah.
And what I knew I had Parkinson's, and I wondered if I was imagining things. Like I was like, am I really changing, or am I, I wanted to sort of separate the possibility that I was somehow inducing this myself. And so I just directly sought out a neuropsychologist and went through the whole battery of cognitive testing that you can have. I don't think that's necessary for everyone. And Joe, do you agree that it's not a requirement?
Yeah, I would agree. Neuropsychology is time consuming. Most patients are not crazy about going through the tests, and a few hours long. But in the right circumstances, it can be really informative and give a lot more information than I can get from the little bit of testing that I can do in the office. So it sounds like you had a pretty good experience with getting some good feedback.
I did, because I just wanted to know if it was real.
Yeah.
Like, was there something that could be identified? And that was all I needed to know. It was a relief for me. I'm like, okay, it's real.
Yeah.
And we talked about then, started talking about coping and things.
Yeah. The other thing that neuropsychologists can help with, something that we all struggle with as we see changes, whether you have Parkinson's disease or not, what's normal aging, what's something serious, what's something trivial. And the neuropsychologists have age-adjusted tests and everything can help us to sort those things out.
Right. Johnny, when this started, how did it make you feel? Like, how did it affect you, not just your thinking, but how you viewed yourself?
I have to be honest and say that it struck me with fear because I was afraid I could no longer competently take care of my job and of my people. And I didn't know any way out of it. I was a genius at planning. And then all of a sudden I couldn't finish a sentence and I couldn't plan anything that I could bring to completion. And so I was just left feeling lost.
It was very much the same for me. I didn't like identify myself personally as, hi, I use my brain a lot. But my thinking skills were a part of who I was. And losing those, and that is actually the basis of my long-term disability, was my cognitive changes, because I could not function in that role. And so I went from working a lot to not working and having, I didn't even know who I was. It was very disconcerting to sort of rethink who I was without one of the skills that I had relied on.
So I'm wondering if our medication has anything to do with this. Like in the early stages, I'm taking Parkinson's meds, and I've never taken meds before. All of these I see have side effects. Do any of those things affect the way that we're feeling and thinking?
Do you want me to take that?
Yeah, please.
Yeah. So the medications for Parkinson's disease definitely have effects on the way that we're thinking and feeling, and sometimes in adverse ways, bad ways, and sometimes in good ways. So I not infrequently see people who have a lot of depression and anxiety associated with their Parkinson's disease, and treating their motor symptoms, with the typical medications, sometimes improve those symptoms as well as the motor symptoms. I also have some people who have not so much memory problems, not so much executive problems, but just their thinking is slowed down in the beginning. And those people sometimes will have some cognitive benefits from the medication. But on the flip side, the medications can also muddle thinking. They can affect perception, and can sort of interfere with our ability to concentrate. Some medications more than others. I'm a little hesitant to start to get into particular medications and particular side effects, because these things really do need to be individualized, and you need to talk them over with your doctor. But it's very definitely true that medications affect. I mean, these medications you're taking for Parkinson's disease, you want them to affect your brain. You want them to affect the motor parts of your brain. And then they can also affect the way you think and the way you feel, as you put it, Johnny.
And I'm curious, do you in your time with a person with Parkinson's, are you able to identify that they are having thinking changes, or is it more common that they tell you?
It's both. And on the part of us sort of surveilling for thinking changes, recommendations from the American Academy of Neurology and other bodies that kind of have guidelines about how to manage Parkinson's, we should do a cognitive test at least once a year. And a cognitive test is not the 2-hour to 4-hour neuropsychology thing we were talking about, but a brief screening test. And we're supposed to do that. Now, as you guys know, as patients, the visit time goes quickly, and sometimes it's hard to fit everything in. And we all try to do a good job of this. But that is part of the standard, I think. And then as far as patients telling me, patients do tell me they have thinking problems, and they do so quite frequently. And the challenge there is really sorting out what's a serious problem and what's a minor problem, what's a normal age-related problem. And
Right.
so my question to the patient is usually, tell me the most extreme example of what you're struggling with. And if the patient says, well, sometimes I go into the next room and I can't quite remember what I went in there for, I think, well, I do that 4 or 5 times a day myself. I'm not too worried about that. But if they give me more impressive examples, like the two of you each just provided, then we look into it further, and we start with some screening tests, and then if appropriate, we call in the neuropsychologist. The other specialty that we should mention here is many speech pathologists are able to do good cognitive assessments. And if you don't have access to a neuropsychologist, some of the speech pathologists can be helpful with that.
Johnny, how have things changed as time has gone along? And what kinds of coping or compensating have you done? Coping mechanisms or tools you may have adopted?
That's easy. This last year, I couldn't get my checkbook to balance, no matter what I did. But even worse, I began to lose understanding of numbers themselves. What do these things mean? And so Judy and I just decided, rather than live under stress all the time because of that, we were going to hire somebody to do our checkbook once a month. And she's a brilliant gal who loves math, and we trust her, and she does it. And it's a wonderful life now.
And cooking, as an example, was at that time, like one of my friends taught me to get every ingredient out that you're going to cook with, and as you use it, put it away. And that way, if I get lost, like if somebody comes to talk to me and I was in the middle, I don't know where I am, at least if it's not out, then I have used it. And I thought simple things like that are helpful. Joe, what kinds of advice, or do you have recommendations for people?
Well, I do encourage people to look for help when they need it. The example that Johnny gave was a great one. And then compensatory strategies like you're describing. I don't personally have great compensatory strategies to offer myself, but our occupational therapists will often be good for that sort of thing. So we do look to other professionals to help us out with these things. But with a little workrounds, people can usually do pretty well.
I think
it's
there
not
are
a bit, yeah.
many, like visual cues. Like, so if I know I need to do something, I might put it where I can't, like I'd have to step over it to, in order to miss it. Like, Johnny, do simple things like that to just to prompt your memory or your concentration or whatever issue you might deal with?
Yes, I put something that's meaningful to what I'm wanting to remember on top of whatever it's related to. And if I get the two of them together, usually I can remember what one or the other was for, or I write it down. That's the simplest thing. By the way, I've also found I can't write anymore. I can't write.
I was about to say, writing down at some point becomes not that helpful.
Yes, it takes me sometimes an hour to write 3 sentences. But I have found that if I use the tape recorder, not tape recorder, I've forgotten. If I use the tape player anyway, I want to.
Of some kind.
Yes.
It's a text.
Yeah. So I do the automatic where I speak into it rather than having to write, and that gives me freedom.
Yes. And the same with me. I too can no longer do my checkbook. But in my case, my husband does it. And then just in the last year, it just became too difficult for me to load my medications into the, if you're not using a medication distributor, like what you should take and when, some sort of organizer, I do highly recommend those. And I just got to where I couldn't really do it. It wasn't like I'd make terrible mistakes, but it would take me a long time because I'd put things in and I'd go, did I just put all those in nighttime and they should have been daytime? And I'd drop them, so my dexterity had something to do with it. And it's just easier to have my husband do it. And one of the benefits of that has been, it actually has brought him into my care in a way he wasn't before, because I take a number of medications and he now is curious what they're for, like what each one is for. And as we go to doctor appointments, he'll say, is that he'll have a reference point that he didn't previously have. And so I think there's, it's been a couple of benefits to that.
Yeah. I'm glad you brought that up, Lisa. That is something that I encourage. That's probably the one concrete compensatory strategy. But, as the person prescribing the medicine, I think it really makes a big difference. And your point about bringing the family member in to become more familiar is really helpful too. And then it just, removes one more stressor.
I was going to ask, how has it affected your relationships, like with your wife or your kids or your friends?
I don't know how to answer that. I'd have to think about that because, well, I know that one of the things that has affected in social relationships is that I used to love to play games, and my wife and I would play Scrabble every night. And then almost all of a sudden, I could no longer play Scrabble. I had fear when I played. I think it was a fear of losing, but I couldn't put it all together and do scoring and all of that. And that happened exactly the same thing to my sister, who was 10 years older than I, who got dementia, and she had the same thing with the games.
Having to withdraw from things like something you enjoyed, game playing, those are some of the harder aspects to, I think, navigate. Not being able to engage with others often are the reasons we end up being more isolated.
Can you converse as deeply with your husband as you could before?
No. I mean, one of the things is so concentration is a big part of it for me. So reading a book is even hard, like concentrating enough that I can remember what that page said. So I can, so that when I turn the page, I still know where I was. That's challenging. And so sometimes my husband, he'll just lose me, like we'll be talking and I'm trying to talk. I'm trying to listen, but I'll, kind of squirrel, I'm just very easily distracted if it comes to listening attentively. I
think people would be surprised to hear you say that, because as we've talked, you have been completely making sense. Yeah. There's nothing weird about your conversation. And so it doesn't appear that you're struggling, but there are things that go on inside that other people have no idea about.
That is very true. And I've had many experiences, and I would bet you have too, where people would say, I can't see anything. Or I do, like Joe used this earlier, like if it's normal aging things, people will go, oh, I do that too. And it really did used to kind of get under my skin, because I thought, I'm 46, I should have the same complaints as my father, the aging kinds of things that are happening. But I also am using tools during this conversation. So I know how to prep for a conversation now so that I can speak as a patient. I have cheat sheets that you can't see that I can. And I know how to get myself to be able to focus on the conversation and hopefully not go, diverge too far off course, which I'm perfectly capable of doing.
But maybe that brings up a good point about the fact that when these changes occur, they occur in the context of a lot of great preserved strengths, as you're both showing us in this conversation right now. And that's not to trivialize the internal things that you were talking about, but focusing on the strengths and using them to compensate, I think, are what help people out quite a bit.
For me, one of the biggest changes that I made was reducing the number of stressors in my life in every way I could. Because my neuropsychologist, did like, this is your brain under stress. This is your brain. Oh, no, it was this second one this is your brain with Parkinson's, and this is your brain with Parkinson's and stress. Like you act literally like kind of your circuitry doesn't work as well when you're under stress.
Joe, how are we supposed to deal with stress? Is it just taking drugs, or is there a way beyond that?
Yeah, well, I think, one term that's used loosely is modifying the environment. So it's trying to remove unnecessary stressors like you described with the checkbook, right? That was a very practical way to do it. And as Lisa was describing with the medication pillbox. So that's I think the first step to try to remove as many unnecessary stressors as you can. I have been impressed in the last few years as we've made more of an effort to make counseling services available to our patients with Parkinson's disease, that talk therapy can actually be quite helpful by itself. I'll be interested to hear both of your experiences there. And there are other, ways to cope with stress. Physical exercise is a great way to go, and that's important for your Parkinson's disease anyway. And there are other activities like Tai Chi and like meditation that can be helpful. So there's a whole range of things before we get to the medicines, and then the medicines. I am pretty liberal about using because they help. And also because some of the repercussions of stress in Parkinson's disease are not just responses to the fact that you have a tough disease, but really are a reflection of some of the underlying brain chemistry. And if we can push that in the right direction, sometimes we can help with that. So that was a little long-winded, but I did want to hear your take on talk therapy. Have you guys, do you have a sense of how that's been helpful for either of you in the past?
Is that something you've done, Johnny?
Yes, I have with a neuropsychologist.
Mm-hmm.
And it was very helpful in that she was able to point out specific exercises, mental exercises, as well as physical exercises to do. And that if I was consistent in doing those, then they would become sort of implanted in my thinking process, and I would become more capable of meeting those challenges when they came. And that's true. And I don't think I would have gotten that in a class, because in the one-on-one, she was able to listen intently and deeply, and she really understood me. And I just felt so liberated that finally there was somebody who really understood me and understood my thinking process and my feelings. It was great.
That's awesome.
I give a big thumbs up too. I would say the one of the things I still repeat often to other people, whether with Parkinson's or not, but who lose an ability that you used to have, right? So you can no longer do something you used to. And I am really great about taking care of other people. And I am really, really bad about needing other people to do things for me. And he helped me get through that psychological hurdle, because that's not it was, I it was about my neighbor shoveling my sidewalks, I'll just say. And he taught me that she is probably not doing that because she's angry with me. She is probably doing it because she likes helping me. And he said, so you're going to take that from her? She's getting pleasure out of it. And I said, you're darn right I am. Let's talk a little bit about further decline. Like I have a fear of like what's coming, what is my, from my thinking changes, what might I encounter in the future? I don't fret about it, but it's something I'm aware of. Do you worry about it, Johnny? Do you ever have concerns?
Last year, I declined more in 1 year than in the previous 10 to 15 years put together. So yes, that lit within me a degree of anxiety. Is there going to be any medication to help me through this? Or am I just going to be stuck out with nothing to help? That was the big one. Is there a medication that will help no matter what?
Dementia can be a part of Parkinson's, and it's not uncommon with longstanding Parkinson's, but it's also not uniform. So not everyone develops problems that are that severe. It's a little tricky to predict exactly who is at highest risk. So I don't think I would give any specifics there, although it's an area that the entire Parkinson's research community has realized is very important. And we've got this big window of opportunity to intervene before people get in trouble. So there are lots of efforts in that area. In terms of medicines that are available, there are 2 classes of medicines that are called cognitive enhancers. And one of them has shown some benefit in Parkinson's dementia. The other one, there may be some benefit, but it's a little less compelling. So that's encouraging, but they're probably not as potent as we would all like. And as far as the advice I give to people, it's really, and I'll refer to, we had a lecture many years ago. It was about dementia in general. And we had a professor from Johns Hopkins come and take us through the medical literature on all the things that could be done to prevent dementia. And it was really a tour de force, really a beautiful lecture. But at the end, her last slide was, do all the things your mother told you to do. So eat right, exercise, socialize, don't drink
Get
too
enough
much,
sleep.
all those things. But, the way that I communicate this to patients is, the Parkinson's disease is in one part of your brain. You got to keep the whole brain healthy, and your brain is in your body. And that's, if we can think about whole body health, then I think I'm convinced we really do make a difference in how things turn out cognitively, at least in some patients. So that gives people, I think, something concrete to focus on. And that's the message I like to give them.
That's a great message. And that's a great way for us to wrap up this discussion. Thank you, Johnny and Joe, for the lively discussion. And
Thanks to you.
Yes, thanks
we
very much.
appreciate
It's been a pleasure.
everyone. Thank you. We appreciate everyone being with us. And that will conclude our talk today.
Thank you, Lisa, Joe, and Johnny. If each of you would please join me on video for our live Q&A session. Hello, Dr. Quinn. Hello,
Hi.
Lisa. Hi, Johnny. Welcome, you guys. I just want to say that we've had an overwhelming response of questions for each of you. So really grateful for your vulnerability and time to share your stories and your expertise behind thinking changes in Parkinson's disease. To start, Lisa, one question I wanted to propose to you is, what advice do you have for family members who suspect that their loved one is having thinking changes?
A great question. I'm gonna try to answer more broadly than just my personal experience. Like, so from stories I hear from caregivers or other people with Parkinson's, I think some of us are more likely to lean into the discussion and, like me, want to know more. You know, I have this, to me, it's comforting to know more. I think for some, it is not comforting to know more. It is, in fact, makes it more scary. So I would say if it's your loved one, knowing the difference, I mean, assuming you know kind of their position on, well, not just getting help, but maybe discussing things that are hard. If you are talking with somebody who you think would not easily want to engage in this discussion, maybe you do it with somebody like Joe, you know, so that they don't feel like, you don't want to make the person defensive. You don't want to come across as and put me in a position of defending myself. So knowing the difference is ideal. If they are someone like me, I'm probably going to engage you. But I know there are many people who are not like that. And I would say take a look at perhaps other your physician or other expert people they consider experts, and seeing if you can get some support in that manner.
Thanks, Lisa. Johnny, if you would unmute your microphone, and if you have anything to add on, what advice we might give to our loved ones who are having trouble speaking to, say, their person with Parkinson's who might be experiencing thinking changes.
I think you asked me a question while I was trying to focus on unmuting. We can't do two things at once, remember?
Right.
And as simple as that was, it took total concentration to do the first part.
Yeah. Yeah, that's a very real sentiment. So thank you for pointing that out. The question is, what advice would you offer a loved one who's concerned that their person with Parkinson's is experiencing thinking changes?
I think that for me, the most important element in my life is Joe. I want to have a movement disorder specialist who really understands the disease and understands me. And when someone comes to me and says, I've been diagnosed, the first thing I ask them is, do you know what a movement disorder specialist is? Are you willing to go to one? Can you find one? And I beg them, I say, the other doctors are all wonderful, but no one understands Parkinson's like a movement disorder specialist.
Great. Thank you, Johnny. Dr. Quinn, would you like to comment on any advice to share to a care partner or a loved one who might be encouraged to speak to their person with Parkinson's who might be living with some thinking changes?
Well, I think, you first start by trying to talk to the patient, but I hear very frequently that it's hard to sometimes persuade the patient of the problem. And I would remind you that although the physician is bound by confidentiality rules from speaking to you, it's as a family member, it's fine for the family member to communicate with the physician. There's no rules against that. So if you want the physician to evaluate thinking problems, discreetly getting a message to the clinician is perfectly permissible, and that happens with some frequency. So again, there's no rules against communication in that direction. The confidentiality complicates things in the other direction. And I find that is helpful. And then, as we said in the video, it is part of the standard recommendations to do a cognitive screen once a year So the clinician can point to, well, this is just a routine thing that we need to do. And that's a good way to start the ball rolling.
As a follow-up to that,
Great
Dr. Quinn,
suggestion.
we did get a few questions about the neurocognitive testing, and some people pointing out that it might be helpful to get a baseline of where we're at cognitively so that we can track progression in the future. Is that something that you, as a movement disorder specialist, would recommend?
Yeah. So there are a few brief tests that can be done in the course of a doctor's visit. They typically have 30 points and they take, maybe 10 minutes to do. So that's a really nice starting point. It takes a little bit of time, but not an outrageous amount of time. It doesn't require a neuropsychologist, and they are sensitive to the tests are sensitive to the changes in Parkinson's disease. So that's a real nice starting point and something that we should monitor over time.
Thank you, Dr. Quinn. Johnny, we got several comments that were directly naming that I ask you this question about your profession. Would you share a little bit about your profession and how your role in having Parkinson's disease kind of shifted your professional career?
Yes, I was teacher, professor, and the president of a university. And mixed in there, I worked in church work as well. So to be a president, you've got to be able to plan. You got to have a vision, know where you're going, know how to get there. And all of a sudden, I couldn't plan for tomorrow, hardly. That was one of the hardest things, especially when we'd gather in faculty meetings, staff meetings, and people would look to me to lead them. And I'd have to say, I'm sort of muddled here. I'm not sure. I gotta try to think about this. And it was hard to think. So I couldn't keep on doing this. Some identified it as burnout. And for a while I could see that fitting, but there were so many complications that just didn't go with burnout. And yet it took years to get an accurate diagnosis of what was going on.
Yeah. Thanks for sharing, Johnny.
I wanted to add that one of the concepts that are in neuropsych testing that we haven't covered at all is visual spatial changes. And those are impactful in many ways, but the one I'll highlight today is driving. So we lose our ability to judge, and it's more than this, but judge distance as an example, or figure out where we are in the world, where my arm is in the world, or where it is in respect to my body. And as that progresses, and I started out in the third percentile, so I didn't have very much room to drop. But I think it's very important that we be aware that that's one of the ways we can decline. And particularly as it comes with important decisions like how long do we drive?
Yeah, and very important, Lisa. Thank you for sharing that with our audience today. Dr. Quinn, we've gotten a lot of questions on progressive thinking changes, dementia, advanced Parkinson's disease. A question from our guest: how common does Parkinson's affect slower thinking and or concentration? So is this common in Parkinson's?
Yes, it's very common. The effects on concentration and on speed of thinking are extremely common. even in very early stages of the disease. I think the things that become more profound are the ones that Lisa and Johnny have emphasized: the decision making and the multitasking. And Lisa's point about visuospatial things is very important. That's one that can kind of sneak up on you. We usually recognize if we're having trouble making decisions or concentrating, but visuospatial can be hard to pick up on your own, and that's where the testing can be really quite important.
Lisa, can you share what exercises or activities you've utilized that has helped manage your cognitive thinking?
Well, I've already acknowledged the biggest one for me was reducing the stress. And to me, that involved many changes that a lot of people can't make or in a position to make. And so I was very fortunate to be able to do that. And I would say more outside of what we think of as exercise, I think maintaining a social connection with people is really important. And even it gets harder to want to do that. And so having people in your life who both understand that you have some complications, can't think of a better word, and who I just enjoy being around, who are not hard for me to be. They're easy for me to be around. I like being around them. I think that's super important to nourish us in many ways. And so I would say it's similar to what Joe had said about just it's our what'd you say, our brain is in our bodies, and what nourishes my spirit nourishes my body. And like we recently expanded our household to include multiple generations. And while it's a little more hectic, waking up to a 1-year-old who's grinning at you and wants you to get out of bed, is really fulfilling. And so while it, in a way, it adds difficulty, it also adds this, what is quality of life for me? And pursuing that quality that I define is what I think is most beneficial.
I love that you said the phrase, doing what nourishes me, what I like to do, and with the people that I like to do them with. That's really, really beautiful. Lisa, thank you for sharing that.
Sure.
May I add one thing to that? Lisa, you said something that just caused a spring of tears to well up within me. I had to suppress that. And it was a beautiful care for others. You said those who are able to get the help. And it just reminded me that I am so blessed to have so many resources. But I've wondered, where do people get help if they can't afford it? Because this is an expensive disease if you want to keep your cocktail mix at the front line of things.
Yeah, Johnny.
You want me to respond, Johnny, or?
I would love to know what you think, what you've experienced.
I as a part of removing stress in my life, I actually made it harder at first. I moved to a new state. So I got to sort of cultivate the life that I got to pick the people because I didn't know anybody. I was, and so I found community in a church that was, I was very comfortable with. And a big part of my comfort was the focus on community. So it's not just about an event that people attend once a week or whatever the frequency might be that you engage with. It's the people, it's the seeing the people. So if you're able to volunteer, That's a great way to meet people. Some of my very closest friends are people I've met advocating over the years. And so I have a great network of people with Parkinson's who I can call them and just give the short version of what I'm struggling with, and they'll get it. And I don't have to worry about saying something that they'll go, oh my, because it's a hard disease. This is complicated stuff. And Johnny, I'm going to throw it back and say, I'd love to hear you say, our lives can be very rewarding, but that doesn't mean we don't live with a very complicated disease. And so it's finding, like I said, volunteering, something you're passionate about. I think there are ways to stay engaged and just have to know what makes your life quality. Defining what makes my life good, and then seeing ways you can try to manifest that.
I appreciate that very much. Dr.
I
Quinn,
can't hear you, Johnny.
You're on the medical side, Dr. Quinn. How do doctors deal with people who can't afford the care that they need?
Yeah. Thanks for asking me. I've been pondering that as I'm listening to the two of you speak. And one of the ways that we deal with it at our place is with our social worker. So we have a social worker who has some dedicated time to the Parkinson's clinic. And, people with less means are going to be in a particular difficult situation. And we've been fortunate to have social workers who are very creative and be able to find resources for that sort of thing. Another resource that was added recently is a pharmacist. So for when the financial issue is medications, our pharmacist is helping us with access programs and that sort of thing. We don't always use the most expensive medications, and we're actually trying to be sensitive to that. But then the pharmacist helps us a little bit more. The other thing that I was thinking about, or two other things. One is that I'm fortunate also to spend some time at the VA hospital. And the socioeconomic status of our patients there is very different from what we see at a university hospital. And there we've got the luxury of the VA system. We've got a lot of resources that we can bring to bear there to help people out. And then the last thing we should plug, of course, is the Parkinson's Foundation. The helpline is available to everybody, and they're very creative about finding resources for people who are struggling that way.
And I would add specifically, like if you are struggling with being able to afford medications, the helpline has resources that you might be able to work with. And I'm really, thanks, Joe, for saying that, because I think even I sometimes neglect to go the helpline.
Yeah.
And that number is 1-800-4PD-INFO, and we'll have the team drop it in the chat for everyone who might be interested in connecting with the Parkinson's Foundation helpline. Johnny, I wanna throw a curveball here. We have someone asking about your golf game. So going back to Lisa's message of doing what nourishes us, right? Someone's really interested in learning how the thinking changes or your Parkinson's may have impacted a sport that you love to engage in, like golfing.
Well, when I would call the local golf club to try to set up a tee time, the guy who would answer would often say, "Are you the Johnny Miller?" Meaning the one who won the National Open back in the 60s. And one of the things that I could tell them was, look, that Johnny Miller has reached his peak. I'm still getting better. I never did get that good, though. I'm sorry to say. So I have a double problem, and that is not only the Parkinson's disease, but I'm also disabled from a fracture of my spine. So there are effects on my body that complicate it, that multiply the effects of Parkinson's, because they're in the same area, but they're not just exactly the same. And so sometimes we're saying, is that Parkinson's or is that the spine or what is it? I really miss sports. I was a sports writer for years, and I love sports. And I played baseball and played softball and loved it. And now I can't because I can't walk. But I work at it, and every day for 15 to 30 minutes, I do something that is strenuous for me. And it makes me feel relief, and it keeps me tuned up so that I can get outside and try to walk and try to be with people. I love it. And I, as far as I can tell, there is no reason that Parkinson's should stop activity. It may slow it down, but it doesn't have to stop it.
Thank you, Johnny, for sharing. And a follow-up, as this will likely be our last question due to the time. Lisa and Johnny, our viewers are interested to know how you managed letting go of daily activities that once were daily for you, like driving or shifting job responsibilities. A follow-up would be, when do you know to stop? So when do you know when to stop swinging the golf club, playing softball, or driving? So how do we learn to let go? And then when do we know how to let go?
Lisa, help me.
That's a lot. Johnny, do you want to take a stab at that?
I want to listen to you.
So how do I know when? I guess being open to feedback and being self-observant and also avoiding injury. I'm just going to add that to, like if you're playing baseball and you cannot stay uninjured, that, listen to, pay attention to that. I would say just getting worse at it, who cares? Like, as long as you're able to do something, just go have fun with it. From how do you emotionally handle giving up something you used to love? I go through what I call like rapid cycle grieving. And it happens all the time as I lose more of my competent, things I used to be able to do. And rapid cycle, I mean, I feel it. I let myself feel that loss. I acknowledge that loss. I have a pity party for myself. I just don't unpack there, so I have to feel it in my view. For me personally, I have to let that sink in and then go, okay, now what are we going to do? That I've accepted, I moved, this is like a days, not weeks or months. But that's, I would say, how I handle it from an emotional and thinking perspective.
You mentioned hurting to start out with. I would clarify that in one area related to driving. It's not only that I don't want to hurt myself, I don't want to hurt somebody else. And somebody gave me a picture of a accident scene with policemen and people lying on the ground. And over on one side was a gentleman with Parkinson's. And it was obvious that something was wrong because he was shaking. And the person asked the question, now when this group goes away, who are they going to talk to about who caused that accident? It's going to be the one who most obviously probably had something wrong. It may not have been the Parkinson person's fault, but I bet he gets the majority of the blame. I don't want to do that. So what I want to do is to find something to substitute for what I used to do. Something new to love, some new people to try to spur up my life. There's folks out there who are very lonely, and Parkinson's people are sane and nice. There's nothing crazy about them. Get to know them.
By Parkinson's. We might be a little nutty, but
I thank you all for sharing your lives with me. It's been great to be together.
same to you, Johnny. And Joe, really, thank you so much for chatting with us. Krista, thank you.
Thank you, guys. This is a
Yes.
pleasure. Yeah.
Thank you all so much for your time and your expertise and your trust in sharing your stories with the world. Really, we have people joining us and listening to your experience from across the world. So thank you all for sharing with us today. I want to say, I know that we had many questions that rolled in, and please know that you can call our helpline, get answers to those questions that you may have. And that number will be dropped again in the chat, 1-800-4PD-INFO. A huge thank you to our panelists, Dr. Joseph Quinn, Lisa Cohn, Dr. Johnny Miller, sincerely from the deepest depths of my heart. I hope each of you continue to do the things that nourish, as Lisa says, that nourish your spirit. So thank you all as our panelists and everyone who's joining us. A little reminder that you all will receive a follow-up email that will be sent with a survey to provide us with feedback for today's event. The Parkinson's Foundation is proud to develop the programs that we offer through the feedback. Everything that we do is based on what is being asked of our community. So please take some time to respond to that survey as we close the webinar. You will receive a link to view today's presentation and other resources that were asked about in the Q&A. In that email, you can expect that email in about a week. Just a friendly reminder that if you are inspired to move or want to continue your movement journey in Parkinson's disease, this Fitness Friday on March 17th, wear green. We're going to be doing balance in motion. Stretch, strengthen, balance, and celebrate your creativity in this class taught by certified Dance for PD teaching artist Deanna Daly. This class will encourage participants to find their rhythm and joy in exercising and moving to music. You can find more about this event this Friday at parkinson.org/pdhealth. Please join us for upcoming PD Health at Home programs each week for you and your loved one with Parkinson's, including Mindfulness Monday, Wellness Wednesday, and Fitness Friday. Our next Wellness Wednesday will be hosting expert Alfonso Fasano, where we will take a look at surgical options. After several years of good symptom management with medications, controlling Parkinson's disease may become more challenging. We'll learn more about surgical options on March 29th. You can learn more again at parkinson.org/pdhealth. If you had a question today that was not answered, please reach out to our helpline by calling 1-800-4PD-INFO or emailing helpline@parkinson.org. And you can use that same contact info to order our free resources, learn more about our education events that we host weekly, get some books, listen to our podcasts, read blogs. We are here to support you. We thank you again for joining us today and hope to see you in Zoom land again soon. Thank you all.